screen, and we will send an email to everyone if we do have problems with Zoom and have to switch to phone. So with that, I will turn it over to Deborah to get us started.
Thanks so much, Melody. I'm just laughing because someone texted me from California asking about what this white stuff is in my windows here. For those of you who don't know, this is snow, and this is something we get here in New England quite a lot. Anyway, hello, I am Deborah Elwood. I am President and CEO of CF Leads. Welcome to this webinar on the state of gun violence in the United States. We are really pleased to see the interest in this very important and unfortunately very timely topic. From the registration, I can see that a number of you have engaged with CF Leads before, but for those of you who don't know CF Leads, I'll give you just a little thumbnail about us. So we are your national network of community foundations working together to build strong communities. Through CF Leads, hundreds and hundreds of community foundations from all across America, from all different sizes, come together to strengthen their community leadership muscle. In other words, the skills and practices beyond grant making that can help you make a difference. And then we share knowledge, and then we also try to tackle together some of the key issues of our time. So we do this a number of ways. First, we offer a number of intensive peer learning opportunities. So last year, 36 community foundation board members, CEOs, and VPs participated in our Executive Leadership Institute and our Introduction to Community Leadership. This was even virtually. And then we also offer a number of kind of in-depth webinars that address the specific needs of community foundations. So last year, even amidst the travel restrictions from COVID, we hosted a number of webinars with, I think we had more than 1,000 participants. So we held weekly community connections webinars during the early days of the pandemic, so we could really share what we were going through and share knowledge about where we were headed. And then we also held in the fall our Going All In webinar series, when we shared our research that identified the 3 remarkable areas of community leadership momentum that we identified. So all of those webinars are on our website, cfleads.org. Feel free to look at the recordings. But another area of work for CF Leads is in galvanizing community foundations around the key issues of our time. And we are doing this through game-changing issue networks on a whole variety of topics, including racial equity, community wealth building, economic mobility, and now gun violence. And that's where this webinar comes in. And we know that community foundations play a critical role, with your community partners, in addressing local problems. And as it turns out, reducing gun violence has emerged as an issue that community foundations are particularly interested in. So we surveyed the field back in 2019 and discovered that this issue is important to you. Several dozen of you, not more, highlighted combating gun violence as really something you wanted to prioritize. So thankfully, with funding from the California Wellness Foundation, we were able to host an all-day conversation with community foundations last January, just before the world shut down, in Oakland, California, to discuss the trends and hear about promising approaches to address gun violence. And now, thanks to the California Wellness Foundation, we're able to offer this webinar, and we'll be offering another, to really help us understand what the state of gun violence is in the country, broken down by race and by type of violence. And then we'll also, in a future webinar, discuss the approaches to reduce it. Also, with the foundation's support, we'll be creating a network of 6 community foundations that are interested in working intensively together on this issue in 21 and 22. So that's a little bit about us and about how we got involved in this work. Let me tell you a little bit about our agenda. First, we will hear from our speakers from UC Davis on gun violence data and trends, those that are correlated to the pandemic and the economic downturn, and so also research about community violence data and trends. So our speakers will address both of those things. Then we have plenty of time for Q&A. Please feel free to ask questions. And as Melody mentioned, please put your questions in the Q&A box, and feel free to put questions of a more technical nature, if you will, in the chat, or any comments you want to have with each other. We urge you to use the technology as much as you can. So now I'd like to introduce our speakers. Dr. Garen Wintermute holds the Bakker-Terrett Chair in Violence Prevention at the University of California, Davis, where he directs the UC Davis Violence Prevention Research Program and its Firearm Violence Research Center. Garen is a practicing emergency room physician and a professor of emergency medicine at UC Davis School of Medicine. He was among the first to study firearm violence as a public health program. I am happy to report that Dr. Wintermute has received both of his doses of COVID vaccine. We know that this has been a really long year for you, Garen, and for all of you in the front lines, and we really thank you for all you're doing for us. I'm also going to introduce Shani so that we can transition smoothly from Garen to Shani. Shani Buggs is an assistant professor in residence with the University of California Davis Violence Prevention Research Program. Her primary areas of research include community-level gun violence prevention and comprehensive approaches to reducing gun violence through policies and programs at all levels of government. Shani has completed her master's in public health and her doctorate in health and public policy from the Johns Hopkins Bloomberg School of Public Health. And Shani has received her first dose of vaccine. So we're getting there. Garen.
Thanks very much. Hello, everybody. I'm on call today, so I've got scrubs on, and I'll just say, get the shot. Don't waste your shot when your time comes. Shani and I are going to be very brief, and pretty much I'm going to set her up. I'm going to give a very brief reminder of the history that we've all just lived through, and some very high level illustrations of the epidemiology, the who and what and when of firearm violence in the United States. And Melody, you've got control of the slides, I think, so if you could hit the next one, thanks. Let's just start with where we are. We've all lived through this together, so some reminders. A year ago, there was the beginning of a very substantial increase in firearm purchasing in the United States as the pandemic was developing overseas and a time of social unrest was foreseen here. We've estimated that there were more than 2 million excess purchases of firearms just in March through May of last year, and a surge in violence followed that surge in purchasing. COVID hit, and the disease itself and our responses to it, the shutdowns and so forth, resulted in what continues to be an extended time of fear and loss and grief and uncertainty. Employment tanked. We all were stuck at home. There was concern that was well-founded that domestic violence would increase, that there would be increases in community violence, if only when shutdown orders let up. And then came the later spring and on into the summer with instances of police violence, police homicide that I won't recount here. Those instances, reactions to it, and other things happening in the background led to what used to be called a hot summer that really extended on into fall, with rates of violence in some cities hitting levels that had not been seen for decades, rates of violence in other cities, not so much. All of this exacerbated by what I'll summarize as a complete absence of leadership from Washington, which, given the quality of leadership when it was demonstrated, was maybe a good thing, that it was maybe mostly gone, but I'm being snarky here. On into the fall, we have an election. We have a disputed election, a continuingly disputed election. We have the return of violent domestic extremism, a formal announcement of the risk of which was issued just yesterday by the Department of Homeland Security, all of which, and some developments likely to happen this year, have people thinking, is this a permanent change? Are things going to get worse before they get better? Melody, the next slide, please. This, we're going to look at some data. This is a picture you're familiar with, even if you've never seen it. This is for 2018, death rates for firearm homicide for males by race, ethnicity and age in the United States. This is the story of the truly remarkable, tragic, preventable concentration in risk for firearm homicide among young men of color, and far and away more than other groups, young Black men. But let me show you another slide, if you would. Thanks. Same thing, but now we're looking at suicide. I first want to point out that that y-axis, the vertical axis, only goes to 50 here. It went to 100 on the prior slide. Rates of suicide never hit what rates of homicide do. But notice the other differences. For suicide, white men are at highest risk, and risk goes up, and then up even faster with age, contrary to what happens with homicide. It is a fact of the matter that beginning at about age 35, a plurality of men who die from firearm violence, and shortly thereafter, a majority of men who die from firearm violence in the United States are white non-Hispanic men. So all of that by way of saying, let's remember to think broadly. One more slide, please. And this is my last slide. Something that sometimes gets overlooked. As we focus on the groups at high risk, let's pay attention to this window of low risk. We don't take nearly enough advantage of it. This is, again, homicide males 2018. And note that for about the first 13 years, at least at the aggregate level, nearly nothing happens. We have quite a long period of time in which we might be able to intervene preventively before risk develops. I'm going to stop there. Shani's going to take over and give the presentation that is the focus of our pair, and then we'll move on. Shani?
Thanks, Garen. Next slide, please. So Garen began by talking about where we are, and we'll be trying to disentangle those societal shocks and their relationship to gun violence for some time. But one thing we know now is that in 2020, the rate of firearm violence wasn't the same across all cities, as Garen said. This slide shows firearm injury rates for 19 major cities in the United States. The lines of greatest interest are the dark blue lines, which show firearm injuries for each of the 19 cities in the first 7 months of 2020. The red and green lines show rates for 2018 and 2019. And the takeaway from this slide is that, as he said, there is no consistent pattern of firearm violence across these cities when you compare 2020 to 2018 or 2019. For some cities, firearm violence increased. For others, it appeared to be in line with prior years. And all of the lines have different peaks and shapes. So we don't see a uniform pattern of firearm violence across cities in 2020. And this is important because each city, each jurisdiction needs to understand what's happening locally to be able to tackle the problem effectively. However, there are some key consistencies associated with firearm violence in communities across the country. And a quick definition, when I talk about community firearm violence or community gun violence, I'm referring to interpersonal violence with a firearm that occurs in public spaces and does not involve intimate or domestic partners. There are a number of common misconceptions about community gun violence, and I want to quickly address 3 of those misconceptions because they can get in the way of effective solutioning. Next slide. The first misconception is that there are entire communities or cities that are violent or bad, when in fact, community gun violence has a disproportionate impact on some US communities and is highly concentrated in certain places and among certain people. Garen showed slides that highlight the disproportionate impact of firearm homicide on Black males. That violence is also concentrated by place. As this slide shows, in most cities around the country, only about 4% of the city's blocks account for about half of all of the violence in the cities. Next slide. But that concentration isn't just geographic. Gun violence is also concentrated among people within social networks. And those social networks are influenced by proximity in place. We know that a substantial share of gun violence in any city is committed by a tiny fraction of that city's population, even in communities with high rates of gun violence. For example, in Oakland and New Orleans, which are known for having high rates of gun violence, 50 to 60% of the firearm homicides involve less than 1% of the city's total population. Next slide. The second misconception is that communities with high rates of gun violence are just inherently violent, that they've always been violent. When what research and experience have shown is that structural racism and discriminatory practices have led to conditions that foster community gun violence. And this slide is just an example to help illustrate that point. The map on the left of the screen is a redlining map of Baltimore from the 1930s. And the red and yellow areas of the map were deemed least desirable for residential and economic growth. And they're the areas where banks would not give loans to buy homes or commercial property. The map on the right shows where homicide and non-fatal firearm injuries occurred in Baltimore approximately 70 years later. And you can see how the violence is clustered in the same areas that were redlined. Decades of disinvestment in those neighborhoods has led to concentrated disadvantage, including high rates of unemployment, poverty, and income inequality, scarce opportunity, and high rates of criminal justice contact and incarceration. And those factors have consistently been linked to high rates of violence. The third and final misconception I want to touch on is the notion that the only way to address community gun violence is with more law enforcement. What we know is that community-driven and properly financed strategies that are intentional and supportive and foster growth, self-sufficiency, and self-efficacy have shown remarkable impacts on gun violence outcomes. Programs such as Advanced Peace in Richmond, California, Stockton, and Sacramento, the Gang Reduction and Youth Development, or GRID program in Los Angeles, Ready Chicago and Becoming a Man in Chicago, and Cure Violence in Philadelphia and New York have all been found to reduce community gun violence. And these programs are successful because they focus on where and whom gun violence is concentrated, and they work in various ways to counter the harms of structural racism, trauma, and community neglect. And with that, I'll stop so that we can get to the fun part, your questions.
Still muted there. Sorry about that. Thank you, Garen and Shani, for taking what is complicated and making it so simple for us to understand. Thank you very, very much. So if any of you have questions, please go right ahead and put them in the Q&A, and we're happy to forward them on to Garen and Shani. Before we take questions from participants here, Garen, let me ask a question of you. You know, we talk about, or you talk about how we can understand gun violence as a public health issue. And you even reference in your bio that you were one of the first to kind of research that topic. What does that mean when it comes to gun violence?
A few things. Public health thrives on complexity, but the approach came out of work that had been done with infectious diseases and injuries of other types. Basically, the idea is that you can break down the series of events that leads to a shooting by who's involved and where does it take place. It's called an epidemiologic triad, the host and the agent and the environment. And the idea was initially, let's pretend that violence is a public health problem. Let's study it that way and see if it's helpful. Actually, the best articulation of this came from a former Surgeon General who said, actually didn't say public health, he said health. And I've come around to agreeing with what he had to say, but he said quite simply, look, if violence isn't a health problem, why are all these people dying from it? Okay,
Right.
so we took that approach and it turned out to work. It led to a productive way of breaking down a complex problem so that we could focus on what do we need to do about the production, manufacture, and distribution of firearms? Point sources of firearms, just the way we have smokestacks that are point sources of pollutants.
Yeah.
What do we need to do about the concentration of risk in place that Shani talked about? We call them hotspots sometimes. What do we need to do about the concentration of risk among people? Young Black men for homicide, older white men for suicide. Strategies are going to be different. We have to think it through. And it has turned out that acting as if violence was a health problem was productive. We could study it. We could come up with solutions based on that study, put those into solutions into practice, and using established public health tools, evaluate those interventions and find out that they worked.
And what did we do before kind of taking this public health approach?
We siloed. Nobody talked about firearm violence as a unified sort of thing to approach. There was a crime problem for homicide and assault. Suicide was, first off, a mental health problem, but there was no public perception of suicide as a problem. It was stigmatized. We didn't talk about it.
Right.
Unintentional injuries were seen as something for the safety community to do. And one of the initial insights was to say, excuse me, we've got homicide, suicide, unintentional injuries. We have this product that is associated with all of them. Let's focus a little bit on the product. And that's what launched this field about 40 years ago. And that was thrilling and very productive. And then complexity got added over time.
Great, thank you. You know, Shani, this work calls on looking at the quantitative data, which you showed us vividly, but also hearing from communities themselves to listen to their experiences and their suggestions versus doing either one of those things. Tell us about your thoughts on this. How do you develop those strategies, combining sort of the quantitative data and the lived experience data from communities?
Yes, it's a great question. I think, so the quantitative data that we have around gun violence is really limited to what we have from law enforcement, from criminal justice systems, and then from the health systems. So we are able to document with the help of health system data and some law enforcement agencies, we're able to document non-fatal firearm injuries for people who report those injuries to the health systems or to the police. And then we are able to count homicides because it's easy to count a dead body, easier than counting a fatal shooting. But that's what the data give us. They don't tell us anything about, well, they don't tell us very much about what happened in that person's life leading up to that incident. They don't tell us about lived experience. They don't tell us about exposure to violence. They don't tell us about what traumas existed in that person's family and the household prior to them becoming a victim of violence or a perpetrator of violence. And so, and when you, in my research, when I've shown quantitative data to communities, they say, well, that's just part of the story. That's only telling you part of the story. And so, and none of us live in a vacuum. We interact with people, we interact with our environments, we interact with the policies that govern our lives. And so the lived experience, the subjective experiences, the traumatic experiences, all of those things matter in a complex issue such as violence. And so the way in my research, I think it's critical that we marry the quantitative and qualitative data that we marry that information, because that helps to tell us a fuller picture. The way that you do that is by building the relationships with communities. You have to talk to communities. You have to engage those who are highest, who are most impacted, who are at highest risk for violence involvement, who have experienced violence. And that really helps you understand what sort of strategies and interventions are going to be acceptable and effective, because community members know what they know what they need. They know what the needs are and the challenges are of their communities. And we have to hear their voices and pair that with the quantitative data in order to really have the full picture.
Thanks, Shani. That's really helpful. Really kind of gives us a fuller context. So what are some of the promising practices and policies to prevent community violence? I know that your research talks about, we're seeing some progress in Oakland, and you said LA and New York. Can you tell us a little bit more about this? I mean, I know it's complex, but tell us a little more.
Yeah, sure. So those cities, New York, Oakland, and Los Angeles, have been successful primarily for a number of different reasons. One is that they haven't focused on strict application to any particular model. They have taken bits and pieces of different models because they are speaking to the community. They're doing, a problem analysis and understanding what are the needs of the community, and then taking sort of the best of all of the models and putting them together. They work to authentically engage communities. They have community members at the table providing feedback and helping to drive the ship. They provide extensive wraparound services for program clients. They recognize that the needs of the audience that they're trying to engage, the population most at risk, has a host of other life challenges. Often they have food insecurity, housing insecurity. They're, as I talked about, that concentrated disadvantage, unemployment, or underemployment. And so many, when you talk to people who are practitioners, they talk about, missing licenses and social security cards, and how those challenges help to create barriers to finding services and getting help to support individuals and their families. The programs in New York and Oakland and Los Angeles also include life coaching, and they focus on supportive healing and case management and restorative justice principles and community empowerment. They prioritize positive and productive police and community engagement, and really work to have conversations with police and communities about historical harms, contemporary harms, and how those two groups can really work together to create safer environments. And really importantly, they have dedicated resources to the problem. They have substantial and sustained resource allocation for the programs, the participants, and the staff. And so there are a number of different models. I mentioned some at the end of my comments, but I think the models that have been most successful have many of those components that are seen at a city level in New York, Oakland, and Los Angeles.
And how do they allocate resources? I know we've seen these cost of peace versus cost of death, and it's a lot cheaper to invest in the cost of peace. Do they reallocate resources? How does that work, Shani?
So Oakland passed, the community of Oakland, the residents in Oakland, approved a tax measure so that I believe it's 1/2 cent. But don't quote me on it. I can get back to you on that. But they approved a tax measure so that they are, it was first, I think, measure X, and then it's measure Y. But they have built-in dollars to fund public safety measures in the city of Oakland. Los Angeles and New York have city governments that have decided to allocate a portion of their budgets to non-law enforcement public safety strategies. New York is a leader under Michael Bloomberg and has continued. There's been a lot of money put towards the Office of Violence Prevention and put towards crisis response and the cure violence models. And when I say cure violence models, it's the model plus, it's the model plus these other components of that I just described. So they have committed city dollars to funding these strategies in ways that don't require the programs to always be seeking grant funds every year or two and having to readjust their strategies when the dollars run short.
Thank you. That's really helpful. That's really interesting to know that there are models that out there for getting resources out. Last quick question of you, Garen, and then we've got a couple questions from our participants here. Hello, I'm Shanesha from Baltimore. Hi, Shanesha. We're looking to help a group violence reduction strategy with Northeastern University, and we've long been a safe streets city. Actually, this is from Shanesha. How to respond to questions about whether this still works in light of the spikes we've seen over the last year, even in the Miracle City. So I guess that is actually from our participant, and either one of you, if you want to take that.
Let me start, and Shani can back me up. I was going to ask to cherry pick that question. The nub of the answer is overtaken by events. Think of the year that it has been. Our public health system has failed. In many places, our medical care system has failed, and we have not seen the worst yet, folks. The worst is still to come. If an intervention has worked well under less unique, less challenging circumstances, and didn't do the job in this last remarkably awful year, okay, it didn't. Are there ways it can be improved to work even under those circumstances? But I would not judge the performance of an intervention solely on its performance last year. It's just that simple. We're going to have an opportunity to profit from what this year has taught us, come out leaner and meaner, and work more effectively.
Does it give us the opportunity to really reimagine? I mean, one of the, we all talk about all these systems that have failed us, or they worked exactly as they were designed to, and that wasn't to help people of color in particular. Are there reimaginings going on? What are the discussions at the policy level, and at the state and the federal level for that matter?
So let me have like 2 sentences, and then I'm going to give this to Shani. I think reimagining is going on all over the place, particularly with regard to structural racism, which is an element of a couple of other questions. I'm going to give one very small example, a researcher's example. Our group here is intensely pursuing the theme that I'll frame in a question. How is racism baked into the data that we use to study violence? And I don't mean structural factors influencing trends in violence. I mean that the racism is inherent to the data themselves. I'm going to make this observation and then I'm going to stop. I think it's also important, not instead, to remember that violence and disparity travel together along all of the axes on which disparity exists. So race, ethnicity, most assuredly. Gender, you bet. Sexual orientation, gender identity, ability, age. People are being killed in the United States daily for being on the wrong end of all of those axes. And I'm not suggesting we divert any attention from working on race, ethnicity, but we want to keep the broader problem in mind at the same time. I'm going to stop there. Shani?
Yes, and just to that point, Garen, I think the intersectionality that is experienced when you combine those different categories really help to illuminate the complexity of the problem. But I think it's just important to lift up how when you have disparity of race and gender and sexual orientation and able bodies, then you really compound the disparity and compound the impacts of violence. It's a great question. I think I could go on and on about reimagining public safety and what opportunities exist. I agree with Garen around the strategies that worked last year or year before. Judging the strategies based on prior year performance is kind of out the window at this point, given the year that we had and where we are today. What I will say about Baltimore, a couple things quickly. One, Shanesha,
yeah.
Thank you, mentioned Safe Streets, and I would be remiss if I did not recognize the fact that Safe Streets and our country lost a giant in violence intervention last weekend in Dante Barksdale's tragic murder. He was a violence intervention leader. He was a violence interrupter and had been doing that work for over a decade. And he was tragically murdered doing just that work. To the point about the group violence reduction strategy, Baltimore has tried that strategy before, and actually was part of my dissertation work to evaluate the strategy when I was working in the mayor's office and witness firsthand the implementation and sad deterioration of that strategy. What I do know now is that there are brilliant minds thinking about this strategy and how to implement it correctly, mindfully, given the challenges that the city has faced with the strategy, given the challenges that the city faces with law enforcement legitimacy and thinking about how to do those things that I talked about, being intentional, being focused, thinking about the concentration of violence, thinking about how to best support the individuals who are at highest risk for violence involvement. And I think the strategy has the best shot of any that I've seen before. I know it's been tried before.
Wow.
And so yes, there are a lot of great minds on it and working hard to make it successful this time.
Wow. Well, Shawnee, here's another question. I think you've sort of touched on this, but in what you said, Shawnee, you mentioned the correlation of concentrated disadvantage to the prevalence of gun violence. So you're talking about that a little bit just a minute ago. In what other ways does structural racism specifically really contribute to this challenge? It's just a small little question for you.
Yeah. I think structural racism really contributes to this problem and how we've thought about the problem, how we've addressed it in the first place. It has been, we have thought of violence as the end and not the symptom of the problem. And so we have handed it violence prevention largely to law enforcement and said it is your responsibility to control, corral, punish the people who are involved in violence. And we have not thought more broadly, more meaningfully about why the violence is occurring, where is it occurring, who's most impacted, how have we responded to it. Unfortunately, there are children in our country who hear gunshots at night and go to school and are expected to perform in the same ways that children who live in communities that never experience gunshots perform. And we don't stop and say, how does structural racism factor into how we think about that? How do we respond to trauma when you have such concentrated exposure to violence and what that does to our ability to function as human beings, our ability to feel safe and feel, like we have opportunity and the ability to thrive in our homes and in our communities. And so I think that's one of the biggest ways that structural racism, beyond just the neighborhood effects and the environmental conditions, that's a big way that structural racism plays a part.
Garen.
I'd like to piggyback. In many ways, I'm old school. One of them is I have stuck with the term structural for racism or other things as the usage has moved a bit to systemic. And the reason is structures, the existence of structures implies a builder. And I think it's really important to recall that the structures we are alluding to here were constructed on purpose with objectives that they are achieving. One of the ways in which the structural side of structural racism contributes to the problem is those structures cause us as a society, I don't mean us as individuals, to focus our attention on the people who are suffering in one way or another from violence as the problem that needs to be addressed, that they are somehow responsible for the problem. Turn the mirror the other direction. The people whose problem structural violence is are the people who created the structures. I'll stop there.
Good point. That's a good point. Yeah, interesting. From Michelle Decker in California, our counties passed resolutions declaring racism as a public health threat. Varying efforts are underway. Do our guests see new opportunities in the local public landscape for advancing this conversation? Or I would imagine also national landscape.
Yes, I think, sort of to the conversation we were just having, when we begin to think about how racism has impacted how the problem of violence, was created in in communities around the country, how we respond to it, and think about how racism has really, factored into the misconceptions that I talked about. I think that there is real opportunity to think about the ways in which, by addressing racism thinking about how racism exists in every system, every structure that governs our lives, if we think about how we can counter that racism, be anti-racist, think about equity, think about how to repair, how to really invest in families and communities across all categories, then we really can help to make families and communities much safer, much healthier. Yes, and in short, I think that it does give us real opportunity to think about how racism has shaped how we think about violence and how we think about how we respond to it.
I'm going to piggyback again and focus on the first few words of that question, our counties passed resolutions from content to process, and just make a comment about leadership. As Shani just said, how we talk about a problem shapes how we think about it, and how we think about it shapes what we do about it. So one of the many steps that it's helpful to take at the outset is to have the leaders, whether it's formal authority or informal authority, have the leaders of the community start talking about the problem in this new way. And one thing that a group of elected officials can do collectively is say, we say in our official capacity that this problem has a status that it didn't have before. That matters. It changes slowly, bit by bit, changes the way society at large thinks about the problem. And I'm back to rotating that mirror.
Well, oh, go ahead, Shani.
I would say, and now that counties have passed the resolutions, now, residents, community members can say, okay, you recognize that this is a problem. Now let's see how this translates into action. How do we now then, match our budgets, our actions in ways that really address this problem if we're willing to declare it.
And we've certainly seen great success with other public health approaches, particularly car deaths, right? I mean, we did things to help the driver be safer. We did things to help the vehicle be safer. We did things to help the road be safer, and we've made a big difference, right? I mean, I know now with distracted driving, it's a bit of a problem, but taking that approach does give you some very specific steps you can take, approaches you can take.
It does. Back to the first question you asked me. It's the seminal example that we look to. A public health approach was, before it was called that, a public health approach was taken to what was described as an epidemic of motor vehicle trauma. And the epidemiologic principles were applied. The one thing that hasn't changed is the behavior of drivers. Drivers are no better now than they were 70 years ago when this approach was launched. On a per miles driven basis, the fatality rate has been cut by nearly 90% by application of an approach that did not rely on changing the behavior of the people you were trying to protect.
So even teens, as we're protecting teens, nope.
Well, no, it's like this. I lived through this. I was part of the policy development. I'm that old.
Yeah.
Seatbelts were an option in cars. Then we made them mandatory and nobody used them. Then we said, we'll put shoulder harnesses on so we can see if you're not using it, and that didn't matter. And so, okay, we'll require it. We'll make it the law. You have to do it. And some people did, but the groups of people who didn't obey the law were teenagers, the elderly, and people who were intoxicated. The three groups who were already at highest risk. So seatbelt laws, I'm oversimplifying, lowered risk further among people who had low risk to begin with. So what did we do? Airbags. Suddenly, you can be drunk and you're protected. You can be a young idiot. I was one, and you're still protected. That's the point. If we focus on changing the behavior of the people who are at risk, we're going to lose. If we think about the system, if we think about the structures, we have a chance.
Interesting. Shawnee, you want to add anything to that? Okay. That's really really interesting. So another question, with violence concentrated in small spatial areas and groups, as they heard, is it generally important to focus attention to that smaller group?
So when you're thinking about, more immediate impact versus long-term impact, the answer is yes. I'm sorry, my cat just woke up. She's in my lap. So that focused on that concentration of gun violence is really where you will have the most impact, because as I talked about, you're thinking about less than 1% of a city's population involved or connected to 50 to 60% of the violence in any given city. With that said, if we don't think more broadly, if we don't think about the conditions, the experiences that help lead this small number of people to become at highest risk for violence involvement, then all we're doing is responding to the problem downstream. We're not thinking about how do we protect individuals, how do we prevent the violence from occurring in the first place? How do we keep people from becoming at high risk for violence involvement? Garen showed that graph where risk was low for Black males, white males, Hispanic males, up to 13, 14 years of age. And so we can't ignore the opportunities that we have to intervene earlier. But when we're talking about a city that has high rates of gun violence, or a city that's experiencing rates of gun violence, focusing on those individuals who are at greatest risk for that involvement in the violence is critical in order to bring the numbers down and save lives. If you focus, and the problem analysis, I will talk about, how we define the problem, who is involved, who are those individuals at highest risk, vary from city to city, from community to community. And so it's important to involve community members, to involve those who are on the ground in the conversation around who's at greatest risk and what are the interventions that work best for this population. You can imagine that if violence is driven in a community by individuals who are 18 to 20 years old, for instance, the interventions for that group would be very different than if violence is driven by individuals who are 28 to 30. And so it is important to focus on that small number, but you cannot forget thinking more broadly.
Okay. That question was from Terrence Mulligan. Did you have something to add, Garen? Okay. So another question here from Jeff Pickering. Hi, Jeff. Any strategies to address expansion of firearms industries in our local areas? Garen.
Let's be public health-ish about it. we're often asked, both Shani and I, what's the one thing we need to do? And that's a trick question. The one thing you need to do is a lot of things. So I'm going to take that approach here. You have to think, but I'm being public health-ish. You have to think about point sources. Illegal firearm markets in a city can be mapped. You can identify the retailers who, I know this, I've done it, who are disproportionately involved in sales of guns used in crime. Sometimes in big cities, Milwaukee's the example, there's one retailer. Take that one retailer out and the entire city changes. I'm not making that up, that happened. And it reversed when the retailer went back into business. But you can identify the point sources and do something about them. And you just might have an ally in ATF locally in ways that you haven't for years because the times are changing. But you also need to think about they're called diffuse sources, to stick with environmental health, the small trafficking operations that again can be mapped if you have access to adequate data. I'm sticking on the supply side here. On the demand side, we're back to changing structures or doing some of the other sorts of interventions that Shani mentioned. But one thing that we haven't brought up is if I ask a young man to stop carrying, he's going to say, well, what about everybody else? If I'm the only person who stops carrying, I'm dead. It's just that simple. Right. And a couple of things turn out to be the case. One is not that many people are carrying. Everybody just thinks everybody else is, and you can do a little education. But the other is there are things that can be done to deter carrying, or even more importantly, back to structures, reduce the incentives to carry. And I'll end with one thing because you asked me about the industry, and thank you for that. This is coming right around the corner. Ghost guns. You've heard the term. You're going to hear it a lot this year, if only for me. It is now feasible and inexpensive to produce durable assault type rifles and semi-automatic pistols in the comfort of your living room. There is a company.
Semi-automatic.
Yes, ma'am. There is a company that will sell you a machine for about, except they're back ordered. It's called a Ghost Gunner for about $2,000. And you can set up one of those in your living room. You got some money, you can set up several, and each one of them will produce a firearm for you every 35 minutes. At your house, no serial number, no nothing, it's untraceable. If I were going to arm a violent domestic extremist group, I would put a few of those machines in my living room and put myself in business. That's the coming industry trend.
Well, that's optimistic.
Sorry.
Shani, anything you want to add to that? That's pretty scary. Last question from the audience, and then I'd like each of you to tell us anything in particular that you'd like to leave the audience with. So say more about strategies for prevention of youth getting caught up in violence before they get involved. And this is Izuri from San Francisco.
That's a great question. I think,
Hi, Izuri.
One people often talk about what do we do about youth? How do we respond to youth violence prevention? Or what strategies would work best? I talked earlier about the importance of involving community in the conversation. We have to talk to the young people who are at greatest risk for violence involvement. We have to talk to them about their experiences. Many of the models, many of the strategies that we currently know about that have been evaluated don't account for things like the influence of social media in accelerating disputes or in escalating problems, and how public personas on social media that involve braggadocious behavior and flaunting has literally gotten young people killed. And so it is really, really important to talk to young people, to involve them in the conversation around what do they need, and then act accordingly on what they need. I think we really need to get closer to understanding the pain and the challenges that young people experience. And again, there are some commonalities, but it's really important to think really locally, to think about the youth in the communities where you reside, because their challenges may be different, their beefs may be different. And so I hold up like speaking to the youth, listening to their voices, understanding what challenges they're facing when they begin to become 13, 14, 15, what's occupying their time? Who are their peers around them? How are they being protected from the harms, the social ills that exist in these deprived, neglected communities? What opportunities are there? What do the youth want to see there instead? That's all really important.
Yeah, wow, thank you. So each of you, I'll go to you first, Garen, about what you'd like to leave the audience with. Before you do, though, I don't know if you said, I know you did a lot on rates. How many gun violence deaths did we have last year?
We don't know. There's a data lag, somewhere upwards of 40,000.
And that's the highest that has been in nationwide? Or
Probably, again, we don't know, but we will probably have more deaths last year than at any prior year, at any prior time. That doesn't necessarily mean that the rates are higher because the population is larger.
Yeah, yeah. Okay, thank you. So last word from each of you.
Sure, I'm going to be really brief. Scary stories aside, I am really an optimist about all of this. I've been doing it for 38 years now, and bring that experience to it. You all are one of the reasons I'm optimistic, to be quite honest. There are a lot of you on the call. This didn't used to happen. There didn't used to be leaders like you all saying, this is a problem, we're going to show up and do something about it. So I look forward to opportunities to working with you in the future. And
hopefully we'll have some. And you have tremendous leaders on the call who have done tremendous work in other areas. So I share your optimism. And Shani.
Similar to what Garen said, I am thankful to you all for your interest in tackling this complex issue and really leading in this space. My career has been a little shorter than Garen's, but I am equally optimistic because more and more people are recognizing that gun violence is preventable, that there are ways in which we can truly address the problem and that can be effective and different from ways that we have dealt with the problem in the past. And I am hopeful and just really appreciative of the opportunity to speak to you all, and thankful for your leadership.
Thanks to you both for sharing your expertise with us. This was really, really enlightening. And to all of you, we will be having another webinar in the next month or so to really highlight some of the approaches that we know are working, that Shani pointed out, and outline the opportunities for you potentially to get involved with CF Leads more fully, and with some of the experts across the country. So thank you to all of you community foundations who are taking this really important issue really seriously. We know you have a million things on your plate right now, but you have leaned into COVID and you're leaning into community leadership, and it is just an honor to work with you. So thanks everyone. We'll now conclude this and have a great afternoon. Thank you.